This is Helena at Large. I'm Helena Strauss, and this video is about how to care for your mouth if you have ONJ. As usual, these are my views as a patient. They are not substitutes for professional medical advice or the specific advice of your dental surgeon. MRONJ, which I'm going to refer to simply as ONJ here, can take up to 3 years to resolve. And as much as you may want your ONJ to resolve quickly, early surgery at the time of diagnosis has not been reliably shown to help resolve ONJ. So the current standard is to treat ONJ as conservatively as possible if and until surgery is appropriate. This means you will be giving your mouth extra special Olympic levels of care while you patiently wait for the necrotic bone to emerge from your gum as your body works to expel it. You will also be spending more time in the company of your oral surgeon or hopefully an orthodontic and maxillofacial surgeon for regular monitoring of your progress. Now let's go through specifically what this means for you. Number 1, if you are stage 0, meaning you don't have exposed bone, saltwater rinses or gum-friendly rinses like BIOTENE may help you keep your mouth clean and your gums moist. Number 2, if you do have exposed bone, you will likely be prescribed a chlorhexidine mouthwash. Chlorhexidine, while it disinfects your mouth, stains your teeth. So ask your oral surgeon if you need to rinse your entire mouth or if you can just debride the exposed bone with a soft toothbrush or a Q-tip dipped in chlorhexidine. The dead bone feels no pain, so it's not as daunting as it may sound. Number 3, in addition to visiting your dental surgeon more frequently, plan to see your dental hygienist more often. Professional cleaning should be done every 3 to 4 months by a hygienist who has heard of ONJ and will coordinate with your surgeon. If your current hygienist is unfamiliar or worse, unwilling to learn, get a new one. Number 4, if your ONJ is anywhere between stages 1 and 3, your dentist will likely prescribe antibiotics at some point, and likely more than once. Make sure you are vigilant for signs of infection such as pain, numbness, or redness. Number 5, don't forget to floss. Some patients use water flossers. Personally, I was told it was okay to use a water flosser, but to also use actual floss 2 times a day to help with buildup from the chlorhexidine rinse. And number 6, don't forget to tell the doctor who prescribed your bone building drugs that you have ONJ. Depending on your other health conditions, you may need to stay on them, but most likely they will need to be paused or stopped. I know it is a bit scary to be diagnosed with ONJ on top of your other health issues, but think of it this way for a moment. Half of stage 0 cases resolve on their own without ever having exposure of bone. And for a number of others beyond stage 0, 50% will resolve within 2 years before ever progressing to stage 3. For those, surgery may be either minor or not even necessary. Some patients report that the necrotic bone spontaneously falls out. My surgeon told me he's had more than one patient show up with a piece of bone in a little baggie as their ONJ healed on its own with monitoring and hygiene. I hope you will be one of them. I'm Helena Strauss.